There's two types of aseptic non-touch technique, broadly speaking, surgical and standard. And so in IV cannulation, all that's required is standard aseptic non-touch technique, which means that it's usually a short procedure that's technically not too difficult, and there's only a few key parts and key sites that you really need to be aware of. Now, key parts really refers to the fact that there's not too many parts to IV cannulation. The instruments I need are quite few, so there's the cannula, the IV bung, and the tegatum potentially. That's all that really stays on the patient, and the only invasive part is the IV cannula. So it has very few key parts, and I can avoid touching any part of that while I'm interacting with the patient and doing this insertion. Likewise with the patient, there's only really one key site, which is the IV in question and the point of cannulation. And because of this, I also use just non-sterile gloves. If I needed to touch parts of the cannula, which are meant to be sterile, I would then use sterile gloves. So that's why we're using standard technique.